That's a very common scenario that you mentioned, and a common problem that we as doctors face when people come with packages of 20, 25 reports in their hand. And see, so what happens is people are tempted, they are worried, they are cautious, but doing the tests, not understanding them, not interpreting them, and not taking action on them has no meaning unless you follow it up. So people do have blood tests as a maybe offers from some private setups, and they just keep those reports in the file, and then they follow up with the doctor later with some problem, and oh doctor, I had this issue and I never followed up. So a health checkup should not only include testing for particular illnesses, it will require evaluation by a clinician who is experienced in health checkups, evaluation for screening for malignancies or high risk conditions. The person will require good amount of counseling based on what his or her risk profile is, and further advice regarding follow-up. It is not a one point in time thing that you should think of as health checkups. It is a bond that happens over time and should build up over time and carry on forward. So you should look at something like at least few years. And let's say we think that a person is doing fine, but the BMI is 29, 30, 31. So they are following in the obesity category. We don't wait for their the lipid parameters or their sugars or their kidney function, liver function to go haywire and then act upon it. So all these things, lifestyle advice, dietary advice, modifications in their medications if they need any, and advising the right screening after that. So health checkup will not only include testing, maybe blood test and imaging, but also evaluation by a physician experienced in it, and guiding and hand-holding the patient further, or not the patient, the person further, to be able to lead a productive life fully and basically avoid his or her trips to the hospital in emergencies. It should happen that, they should be minimizing their healthcare costs. So besides screening, these things are required. Some of them you could offer packages. So these blood tests by themselves may not be enough. You may require some tools based on that. So there are some, like at Apollo, we have health checkups with some risk screening questionnaires, those tools automatically populate all the data and you get the risk profile of the person, like let's say stroke risk or a cardiac risk. So all these things come with units or centers which have experience and millions of data that they have. Based on that, they have created this data. So those places, I think, are the best suited ones for a person seeking to go for health checkups. That's most important, I believe.